Well, today, dozens of nurses and advocates rallied at the state capitol in Harrisburg for the passage of the Patient Safety Act. The House Health Committee also held a hearing today on the legislation, which would limit the number of patients for nurses. WENY Pennsylvania Capitol correspondent Brendan Scanlon heard from those for and against it. He joins us live tonight from Harrisburg. Good evening, Brendan.
Hey there, Renata. Good evening. Well, House Bill 106, or the Patient Safety Act, would establish a minimum patient-to-nurse ratio for hospitals and other healthcare facilities. Advocates say this is extremely necessary to help reduce some of those poor working conditions and burdens facing many nurses across Pennsylvania. But those opposed are concerned about expensive penalties, which they say can harm many hospitals.
Save staffing! Now!
Today in Harrisburg, nurses and advocates rallied to address an ongoing crisis.
They felt overworked, they felt stressed, they felt unsafe in their working environments. They didn't trust their administrators, and they're like, I can't do this, I'm leaving.
Eileen Kelly is a former nurse. She, like many others, could not continue working in what she calls unsafe conditions, both for nurses and their patients.
We were responsible for way too many patients than any one nurse could safely manage. We don't have a shortage of nurses, but we do have a shortage of nurses that are willing to work in unsafe conditions.
Kelly believes the Patient Safety Act is the solution.
This will save lives, save money, and be the answer to the workforce crisis we have right now in healthcare with nurses.
But opponents are concerned about the mandated ratio and the thousands of dollars in penalties for failure to comply.
Unfortunately, what this bill would do is mandate a certain ratio of nurses in a hospital.
Representative Kathy Rapp says it poses a threat to many hospitals that might not be able to meet the ratio, especially in rural areas.
I want more nurses in our hospitals, but I don't want to see our hospitals fined to the point where they have to close beds and possibly close their door.
Now, advocates like Kelly tell me that this bill could actually help save hospitals money because it increases the quality of care and reduces the chances for readmission and other complications down the road. We'll have more details on this bill up on our website, WENY.com. But for now, reporting live at the Pennsylvania State Capitol for WENY News, I'm Brendan Scanlon. Renata, back to you.